Everyone. My name is Pradeep Goel. I'm the CEO of Solve.Care. It is a pleasure to be here today with all of you and to share with you the exciting work that is going on in the blockchain and healthcare space. A little background about myself. I've spent 30 plus years in healthcare administration, both commercial and government, both from a clinical and benefits administration perspective. And have had the opportunity to work in the US, in India, and in China on the healthcare administration side. And I started Solve.Care about 4.5 years ago, March of 2017, based on the lessons learned over the last 3 decades on what is and is not working well in healthcare. And I would love to share that with you today and welcome your questions and comments. So I will share a PowerPoint deck here briefly, and we will get started. So the vision here is to allow for digital health networks to be launched very quickly, but to have certain properties of blockchain that really allow for greater adoption of these networks. I have personally overseen an enormous number of dollars spent in launching digital health networks, be it member-centric networks or patient-centric networks or provider-centric networks. And what I've found in all these scenarios is that the adoption was below par, less than expected, and we never achieved our true goals of improvement of clinical care and reduction of cost and elimination of fraud and better outcomes for patients and their families. And it was always boils down to the lack of trust between parties. In US, our expenses break down like this: about $3.8 trillion of annual expense, about 1.3 trillion of that ends up in administrative functions, non-clinical, recuperatory functions, and the remaining gets split between hospitals, physicians, prescription drugs, nursing care, dental, home care, and other miscellaneous expenses. But the biggest single category of cost in the US is administration. Now, worldwide, there's additional 5 trillion that is spent on healthcare. While the proportion of administration is lower, there is still a significant pattern, familiar pattern of digital health not being adopted, even though it delivers tremendous promise and it could deliver tremendous ROI, but most companies struggle to see the adoption they expected. And the platform that we have built is designed to address that. The fundamental issue here is healthcare is complex. It's not a bilateral relationship. It's a multilateral relationship between doctor, patient, specialist, pharmacist, home care, family members, and so on. The parties do have orthogonal views of what is their role and responsibility, and that leads to lack of trust between them. Not that we don't trust our doctor, but the fact that all these parties are involved, the trust is not established as a network. And given there are so many regulations and data sharing laws, that trust is even harder to establish and even harder to administer. So you end up with administrative cost burdens in healthcare and inefficiencies and lack of access to care. That is a universal problem. So we decided to build a platform that would simplify healthcare administration, similar to how CRM systems simplified customer relations and ERP systems standardize how enterprises manage their resources. So we are building and have built a platform that really takes the blockchain properties and establishes a multi-stack, full stack platform where application, business logic, data, identity, access management, performance, and cost efficacy are baked into and on top of the blockchain properties of immutability and transparency. Having said that, we decided to start defining and launching digital health networks, which we refer to in our parlance care networks, lifting up on the Solve.Care model. Everything we do has a care dot moniker. So care networks, care wallets, care cards. These are the capabilities through which very effective digital health networks can be delivered by our clients, be it insurance company, be it a hospital system, be it a pharmaceutical company looking to run either disease management or clinical trial programs, be it government agencies trying to address population health needs, or independent physicians looking to collaborate with each other. So the idea of a digital health network embodied inside a care network on a blockchain-based coordination fabric is essentially based on my experience in launching very large-scale digital health networks in the US and similar health networks in India and China, and realizing the limitations and essentially building a platform to overcome those adoption and cost and configurability barriers. The idea of the blockchain here, for those of you who are not overly familiar with blockchain beyond its terminology, is that when a patient and a doctor interaction takes place in a digital health network, by way of an example, there is the ability to essentially write to the event ledger on the blockchain the necessary event level data that allows all the parties in the network to collaborate around that event. So a patient making an appointment can be not just communicated to the physician node, but also can be communicated to the insurance company node, to the patient's family member node, to the transportation driver node. Whatever the participant roles are in the network, they can subscribe to various events and they can read them off the chain. The second property is that the chain being immutable, these events cannot be denied or disputed as having occurred because they did occur. And therefore, it allows for quality of care management, payment management, performance management, both of the physician and the institution, becomes a lot easier, and regulatory compliance becomes, in effect, possible. Further, you can tokenize these events to attribute a value or a cost or both to that event, and that value or cost can then be transferred as part of the event from party A to party B, which can then significantly reduce the cost of administering healthcare. So we have implemented some very complex and very powerful health networks, one around diabetes care, another around insurance benefits, another one around a multinational corporation managing their employees worldwide. And all of these networks share the same platform and access the same network services, but are highly differentiated in who the network participants are and what the network journeys are that those participants experience. But in the end, every network, whether it's 1 or 20 that a participant joins, they join all the networks through the Care Wallet. And depending upon the network they join, they receive network journeys and access to network services from the same lifelong product called Care Wallet, which essentially gives them completely sovereign and decentralized control over their data. So they essentially publish, the user essentially publishes whatever data they choose to publish to the network in response to or because they want to access network services. So an example of a network where a doctor and a patient are interacting across a very long-running chronic care management continuum can include things like the patient interacting with the doctor on vitals, sharing their appointments with the insurance company for payments, managing their wellness program with the employer. Everything happens inside the Care Wallet of the patient or the member or the employee, the consumer, connecting to various networks that give them relevant information. So our clients are essentially publishing networks with the idea that every Care Wallet holder that they wish to invite to the network can easily do so, and the interoperability between networks is automatically guaranteed. So we have launched a variety of networks in the market, clinical in nature, administrative in nature, financial in nature, and now increasingly hybrid networks, which merge all of the above. And these networks are designed to our clients' needs and market position and their investment parameters and their investment thesis, and what exactly are they trying to accomplish, who are they trying to engage, and what services and value proposition they want to offer. But the cost of launching such a network has come down by 100x, in the sense that the network I personally launched, which cost in the US somewhere north of $150 million, about 5 years ago, now we could launch in the $1 to $1.5 million or even less. And these are very complex networks where clinical, administrative, and financial stakeholders have to sign off on the network protocol. So given the complexity of these networks, we can deliver networks at 1/100th the price and 1/100th the cost. And they are tokenized and decentralized, where the network sponsor does not bear all the liability and risk they normally would have. Because all the data is decentralized, so the network sponsor isn't responsible for the security or the consents or the necessary custody and auditability of everyone's data. Every network participant is sovereign, participates in the network per the network rules, and maintains and controls their own data and their own consents. Our vision is that a true use case of health of blockchain is really around elimination of waste, cost, abuse, and friction out of healthcare. And if you were to just look at the US, given that we are wasting about 1.4 trillion a year in administrative overhead, that represents a true opportunity in that single country. But globally, in terms of improving access to care, in terms of improving outcome of care, in terms of reducing the inequity of healthcare that we see growing with the pandemic, this is a massive opportunity. And we have done the heavy lifting. Now we're looking for and are inviting a variety of resellers and partners to use our decentralized tokenized platform to implement care networks that actually make sense for their particular audience. The type of partners that we currently have range from pharmaceutical companies to transportation companies to technology frameworks to large-scale, large physician clinics. And the type of entities that are building new networks on our platform are device manufacturers, consulting firms, integrators, physician groups, pharmacy networks, insurance companies, government agencies, and increasingly more decentralized finance developers, artificial intelligence and virtual reality developers. These are the type of entities that find that digital health networks married to their expertise can deliver significant and transformative experience for patients and doctors alike. With that said, that's a quick summary of what Solve.Care is. I will be happy to take any questions, and I appreciate the opportunity to speak with all of you. And I'll turn it over to the moderators for any questions.